So we have exciting guests today.
So true. Hollywood comes home to Washington, D.C.
Taraji P. Henson is here to talk about the foundation established in her father's name.
The Boris Lawrence Henson Foundation was created in 2018 to destigmatize mental health within the Black community.
Taraji and her executive director, Tracie Jade, are coming up in just a bit.
From First Focus on Children, this is Speaking of Kids. I'm Bruce Leslie.
And I'm Messellech Looby. Speaking of Kids is a podcast that puts kids at the center of public policy. May is Mental Health Awareness Month, and at First Focus, we're trying to do our part to highlight this important issue as it relates to children and families.
The data on children and their mental health crisis is pretty profound. We talk about it as being a crisis, and what we're seeing is that 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year, and that suicide is the second leading cause of death among people aged 10 to 14.
Yeah, I mean, these stats are staggering. And, the rise of smartphones and overprotective parents and, overall the rewiring of children is really all lending itself to a really large mental health crisis across the country.
The COVID crisis exacerbated this problem. In addition to exactly as you said, the use of smartphones and those kinds of things have really created a crisis among kids that, as a nation, we really need to address.
And what I love about our guests today, Taraji and Tracie, through the important work that they're doing through the foundation, is they're really elevating the issue and the impact of mental health as it relates to Black children and families. Because we know that a lot of times the issues that are just out there, when overlaid with race and just the state of the country and the history of this country, it can be difficult. And so I'm very excited to get into the conversation today.
And one of the great things I think also about them is they really get the interrelatedness of all of this. And so if you're having a healthcare crisis, a mental health crisis, then your education is going to suffer. And it causes this sort of cascading effect in your life. They've really emphasized things like the effect of poverty on these kinds of things as well. So I'm really excited, they have a very good sense of sort of the whole needs of children and how that affects the, kids' mental health.
Absolutely, Bruce. We've been working on the cross issues of kids, and mental health is one of the newer issues that have emerged for us. And I think we see it, and it's so pronounced because we work on the cross. And what I love about the work Tracie and Taraji are doing, both through direct service and through advocacy, are really starting through a prevention lens, getting kids in middle school and high school. And, I think eventually the goal is to even get kids younger and younger through, outlets like meditation, yoga, positive affirmations. These are all tools that we can teach kids and young adults to really think about their mental health in a different way. And I think through education, hopefully, we'll start to see a shift. But as, we pointed out earlier, there's so many different competing factors going on that kids nowadays just have to process and deal with through social media, through, technology in general. And we haven't even seen what AI is going to bring to the table.
The issues that they're tackling are really important because they get that coverage matters, but even for kids who have coverage for adolescents, often insurance doesn't necessarily provide the access to care and the services that kids need. And that's one of the things their foundation is really addressing. And so look forward to hearing your conversation with them.
Yeah, it was a great conversation, very eye-opening.
Coming up, we have Academy Award-nominated actor, producer, and author Taraji P. Henson joining us to discuss the foundation she created to improve mental health outcomes for children in the Black community.
We can tell them all about arithmetic and how do you read and the ABCs and 1, 2, 3s. But when it comes to their mental wellness, it's like it's something that is an add-on, something that could be considered an elective, right? If it's even elected.
Stick around.
Making the world a better place for all children can seem like an impossibly huge task. Some of you may be thinking, I am just one person. What could I possibly do to make a difference? I'm Leila Nimatala, Vice President of Advocacy and Mobilization at First Focus on Children. And I'm inviting you to join us and become one of our volunteer advocates, whom we call our ambassadors for children. Ambassadors are our most active child advocates who raise critical issues with the U.S. Congress and with the administration related to child policy and funding decisions, both for kids in the U.S. and worldwide. But don't take my word for it. We asked one of our ambassadors to share her experience.
My name is Amy Jo Hutchison. I'm a born and raised West Virginian who also happens to be an economic justice organizer, and I'm the founder of a grassroots movement here, Rattle the Windows. What drew me to the ambassador program with First Focus on Children was my lived experience of poverty. As a mother of two, living in one of the poorest states in the nation, advocating for children in poverty is very personal to me. A lot of people see numbers when they look at data and reports, but when I see new findings and reports on child poverty, I see my kids, and I see their friends, our neighbors, and the people who I interact with every day. And I trust First Focus on Children. I have personally stepped into spaces that they've created for parents like me to be heard. What would I tell someone thinking about becoming an ambassador with First Focus on Children? Well, first of all, very few, if any, huge shifts in the way our country addresses economic justice issues have taken place without grassroots involvement. First Focus on Children has created an entry point for people like me to get involved with this ambassador program. It's an easily accessible way for us to become engaged, informed, and to turn our pain into power. I really hope you'll join them.
So please join us, won't you? Check out campaignforchildren.org/ambassadors on how to become a First Focus on Children ambassador and to link up with our fabulous community.
First Focus on Children is a bipartisan advocacy organization dedicated to making children and families the priority in federal policy and budget decisions.
First Focus moves beyond individual issues to serve a more important role, child advocacy. We educate lawmakers and the American public about the issues facing children.
To learn more about our work and ways that you can become an ambassador, go to firstfocus.org.
Coming up on State of Play, Bruce and I get into some of the statistics around mental health outcomes and the state of mental health as it relates to children. Taraji P. Henson is an Academy Award-nominated actor, producer, author, and mental health advocate. She was most recently seen in the award-winning musical adaptation of The Color Purple, for which she won an NAACP Image Award and received a Screen Actors Guild Ensemble nomination. Taraji created the Boris Lawrence Henson Foundation, which exists to both normalize and improve access to mental health services for Black communities in hopes of eradicating the stigma around seeking support and help.
Tracie Jade is the executive director of the Boris Lawrence Henson Foundation, spearheading initiatives to promote mental health awareness and support within marginalized communities. With a diverse background spanning theater, television production, and education, she serves as the co-host and executive producer of the acclaimed Peace of Mind with Taraji on Facebook Watch, a 3-time Emmy-nominated series dedicated to destigmatizing mental health challenges.
Welcome, Taraji and Tracie. Thank you so much for being here on Speaking of Kids.
Thank you.
Thanks for having us.
So it is May. It's Mental Health Awareness Month. Taraji, congratulations on recently being named one of this year's Very Well Mind 25 honoree. It's an award, as you know, given to champions of mental health and wellness.
Thank you so much.
You're welcome. Taraji, can you share a little bit about the Boris Lawrence Henson Foundation and a little bit about your dad and what drew you to create this foundation?
My dad was a Vietnam vet, and, I just don't know who goes away to war and come back regular and normal and fine. So he had his issues, and he was very vocal about them. I noticed how hard it was for him to get the help he needed, with the medical industry here and for Black people and certainly for vets, it's really hard when they come back. And so later on in life, carrying that with me and all that information and watching my father struggle, I ran into my own struggles, mental health struggles, and time for me and my son to get some help. And it was hard. And I called my best friend, Tracie, who's joined us with this podcast and who also runs the foundation. And we got to the brass tacks of what the issues were. And, you know, of obvious reasons, we don't talk about it at home. And we're the resources for underserved communities. So I felt compelled to do something about it, both Tracie and I. And that's how we started the Boris Lawrence Henson Foundation. It's out of my own necessity, honestly.
Yeah, which is oftentimes what we see. There's a need and the need to fill it.
Yeah.
Tracie, can you share a little bit more about what drew you to this mission?
Yeah, well, as Taraji mentioned, I, suffer or have been challenged with mental health issues myself my whole life. I was diagnosed at the age of 13 with an anxiety disorder, and we had no idea what that meant in our family. Again, there weren't any resources to go any further. Mom and dad did the best they could. And so I sort of had to manage that through my adulthood until I was able to do a little more research around it and figuring out why I was having these episodes that was literally crippling. And so, this work is very personal for both me and Taraji. She witnessed my sort of dealing with these challenges. And then, as she mentioned, ran into her own. We were taking this journey together. And it's a never ending story. It's not, we healed something because we started a foundation and, offering these services. We're still learning ourselves about our own diagnosis and how to sort of manage the anxiety and depression as we move through life.
Absolutely. I mean, mental health is something that I wish we could almost get away from the term mental health and just frame it as health, because it's something that if you're living life and you're on this journey, chances are you're going to face something that requires you to talk to somebody, to receive medication, to get some level of services. And we know for Black children in particular, and for Black youth and Black families, stigma around mental health, accessing mental health supports compared to their peers is not always the same. Taraji, we can start with you and then move over to Tracie. What do you see as some of the unique challenges that Black children face in dealing with mental health?
Number one is racism. That still exists. They may not see it right out and understand what it is, but microaggressions that happen, I remember microaggressions as early as kindergarten. I didn't know what to say about them until later. I didn't know where to put them because, you're a child and you don't know about these things yet. So that's number one. Everything stems from that.
Yeah.
How we're left out in the medical field in these conversations. It all stems from that right there. And everything else falls under that, in my opinion.
And I would just add to that a lot of it is also being misdiagnosed.
Yeah.
There are a lot of, Black children who are labeled problem children, or, they're sent to the office as opposed to the social worker or the psychologist. They're not given assessments to sort of measure where they are in terms of their mental health. It's a behavioral problem. It's not a mental health issue or crisis.
Yeah, that itself stems from racism. Why can't our children be seen like other children when they're in need? They're not seen as, well, what's wrong with this child? Because children, they want to please. All humans have issues, right? But for the most part, children want to please. They live for you did a good job. So when they're not doing a good job, 9 times out of 10, they're asking for help. They're reaching out for help. And all we care about is, why won't this child be quiet? Where is their homework? No one's trying to get to the why are we here? Why is this child acting out? And our children are never regarded in that way. Like Tracie said, they're sent to them. Or oftentimes now what we're seeing is the law is being called on children.
Yeah, exactly.
And unfortunately, it's something that you see as early as preschool and kindergarten, right? With some of the issues that you outlined. And it just escalates from there. And to that point, we know between 2007 in 2017, over the span of 10 years, the suicide rate for Black children nearly doubled. And suicide attempts are rising faster among Black youth than any other racial or ethnic group. When it comes to cultural factors within the Black community that influence attitudes towards mental health, how do you both think we can leverage and promote mental health among Black children to really address and combat some of these alarming statistics? Tracie, we can start with you if you'd like.
Mental health and wellness should be a foundational part of curriculum and classroom experiences so that children learn in early development as their wiring processes and understandings about behaviors and relationships, as that development is happening. They should be offered the educational tools. What does this word mean? How do I describe how I'm feeling? What do I do with what I'm feeling? We can tell them all about arithmetic and how do you read and the ABCs and 1, 2, 3s. But when it comes to their mental wellness, it's like it's something that is an add-on, something that could be considered an elective, right? If it's even elected. And so we think as the organization that mental wellness needs to be a mandate in schools. You can't depend on the families at home who are dealing and facing their own traumas, right? And so they're not going to be able to support the child. Perhaps the child can model what it looks like to speak on what you're feeling or ask for help. So it's definitely not enough emphasis put on wellness in schools. Again, it's sort of like a sideshow. You get it or you don't. It absolutely should be a part of the science curriculum in every single school.
And we need more than just one therapist in schools to handle all of these kids. We need clinicians and psychiatrists on hand in schools right there, especially when you get to the inner city schools.
And there'll never be enough, right? We're doing at the foundation as much as we can by giving scholarships to folk who are interested in becoming therapists, who can practice cultural humility. But if you think about the millions who have the challenges that Black people in particular face, there will never be enough. So we also need to consider other modalities. How can we teach children self-regulation? How can we, expose them to yoga and different forms of taking care of themselves as we're waiting for somebody to become available for that therapy appointment?
Absolutely. That's where we started with our partnership with Kate Spade, and we started erecting these respite pods on HBCU campuses. This is something that we need to start as early as preschool, kindergarten. That's our plan, to have these respite centers on every corner in every major city, on all corners. But until we get there, like Tracie said, we're just doing the best we can at chipping away at what we can do.
That was beautiful. And I think, you both underscored this is another component when dealing with Black children, children of color, families, is the cultural competency in terms of the services that are being received. And oftentimes what we see in several federal programs that we advocate for is there's a lot that gets lost in translation when you don't understand the cultural aspects of different communities. What is the foundation doing to combat that?
Well, we have several things that we're doing. Actually, we have a cultural humility training that we're offering to schools across the country. Anybody can pick it up, not only the educators, but the parents, as well as the students, just to understand what it even means to be culturally sensitive or to have cultural humility in the space. So building cultures around differences, questioning as opposed to judging, learning more about other cultures so that there is an empathetic approach to how you speak to, handle, move around different cultures. We also have something called the unspoken curriculum, and that specifically deals with discrimination and biases in schools. And so how does a student advocate for himself or a parent for his or her child? We're trying to teach people to really wrap their hands around this and know that there are biases that you cannot see. These are behaviors that are wired through this lens of racism and discrimination and bias that occur without being addressed. If you have a classroom and there are a certain percentage of Caucasian students and Black students, if you keep seeing Johnny, who's the Black student, sent to the office for every infraction, behavioral issue, but you see the white kid who's sent to the social worker, that's going to say something to that Black child and that white child. So we're like looking at these cultural differences and the biased decisions that are made behind them. And we want to educate not only the parents and teachers and students, but we want them to have open dialogue about this, have hangouts in their schools where they can talk about it in a safe space. Nobody's judging anybody. So those are the things that we're doing directly.
Yeah, our motto is actually meeting people where they are because, this conversation is brand new for a lot of us in our communities. So we don't want to scare a lot of people off. Some people aren't ready to go to a therapist, so that's where things like breath work and sound baths and yoga and movement and grounding and things like that, where people feel, okay, less intimidated by, they're used to hearing words like yoga and, sound baths and things like that are more popular now.
We go into barbershops, we go into hair salons, we go to the basketball courts,
skating rinks.
Yeah. And it's barrier free. They don't have to sign up for insurance or wonder how they're going to pay for it. We bring it to them, acknowledging that that barrier exists in so many different ways.
Absolutely. And I know that we've primarily been talking about children throughout this conversation, but with it being May, we just had our last episode dedicated to mothers and a special Mother's Day episode. And maternal mental health is real. I mean, I'm a mother of 3, and it's taxing and it's challenging. And in order to raise good, emotionally sound humans, the mother and the families need to be on point. And so what ways do you see, as you're dealing with, different folks within the community, how do you see the importance of maternal mental health showing up in these conversations and in these settings?
It's very important because what happens and what has happened to us for 7 generations is because we haven't healed and we haven't even really had the conversations as we pass down our defense mechanisms, our coping skills, which are, a lot of them are dysfunctional because that's all we know. We know how to survive, but we've been band-aid and stitched up. We haven't totally healed from slavery, from things that our ancestors did. So those things live in our DNA. And we're just starting to have these conversations. So a lot of times, we're passing down. I wouldn't say a victim. I'm not a victim, but I am a product of passing down my trauma to my son because I didn't heal. We're in a space now where we put it all on the table because I know I need to heal. But that's where we are, like it's a wake up call to the parents first, because the parents, we're passing it down if we aren't healing ourselves.
Yeah, I don't think there's anything more eye-opening in the journey of self-reflection than when you become a parent and when you become a mother. You start to realize, oh, wow, I have a lot of work to do. Can you share a little bit more about your upcoming event, the 2024 Can We Talk Symposium?
Sure, I'm glad you asked. We have, over the past 4 years, we've had Can We Talk Symposium, which is basically an opportunity for therapists, researchers, politicians, the general public to all come together to sort of talk about the trends of mental health in the Black community, look for different modalities and different methods of addressing these systemic issues. We also have opportunity for new and budding therapists to come through that we can lend some support to. And we're looking for, again, coming up with some suggestions based on this sort of national blanket of information that all of these therapists bring back to the table that we can share with Congress so that they are aware from the ground of what some of the challenges are that may be missed because the research wasn't done adequately. And so it's really an opportunity for us to come together with the mental health community and look for solutions to our challenges.
Thank you for that, Tracie. And that actually leads to my next question is, what do you want members of Congress and other policymakers to know around mental health challenges facing Black children, Black mothers, youth, and families?
Well, I'm just going to go right back to what Taraji spoke about before with epigenetics and the passing down of behaviors from 7 generations and beyond. I think that is not acknowledged enough, and that there's a multi-layering of trauma that Black people possess and are trying to move through, but we're treated as if what they see is what they get. Mm-hmm. And it's the absolute opposite. You don't see the 7 generations that are moving through the epigenetics of people of color. And so more research in that space, more methodologies and approaches to support that specific kind of healing, the layered healing that I think we miss with these blanket research papers that only address what folk are seeing in front of them. That's what I would want Congress to understand.
Yeah, and slavery is something that you just can't get over or forget about. The damage has been done, and we've been living with it for 7 generations.
You can't just get rid of it. You can't go to a therapy session and it's over. It's literally wired in your body, and there's specific treatments, specific modalities that need to be used in order to help people of color to release this trauma that's in their bodies.
Everything is not a mental illness either. Sometimes you're operating from this place of epigenetics. Like sometimes a person snaps and they're just operating from that place. It has nothing to do with the mental illness. Everything is not mental illness. That's why the research is needed.
We have a theory of change at First Focus, and oftentimes it starts with the research, right? Like how can that shape and inform policy? And oftentimes, especially in Black communities and communities of color, that gets overlooked, right? I mean, same thing in clinical trials, same thing in, so many other cases as it relates to communities of color, in particular, the Black community. So the one question, I know this is going to be a good one. This is our last one. I love the way that you, Taraji, and Tracie came together. There's nothing more beautiful than having a passion partner to do this work, because we know it's hard. It can get heavy. Sometimes you're taking 2-3 steps forward and then you take 1-2 step back. We have a budding playlist here, a Speaking of Kids playlist. And so my last question to both of you is, when you have those hard days, do you have a song or an album that keeps you motivated to keep moving forward?
Whew. Oh, so many.
Lord. So many.
We could do top 3.
We could do gospel.
Yeah, we can go blues. We can go a lot of places. I would just say if I had to choose one that would describe what helps me to come up out of, hard times, trauma, etc., and what I'm hoping young people will get is Black Butterfly by Denise Williams.
Denise Williams. Yeah. Black Butterfly. That's a good one, Tracie. That's a good one. I'll bring it up to speed so the kids will be like, what song are they talking about? I'll say Mary J. Blige, Just Fine. Because at the end of the day, you're going to be just fine.
Yeah.
I love that.
Or The Sun Will Come Out Tomorrow. The sun will come out tomorrow, because if you can just breathe through that dark moment, the sun always comes out after a major storm.
Yeah.
Yeah, that's a life lesson, especially as it relates to feelings. No feelings are forever. They'll pass.
They pass all the time. Yes.
They do. Taraji, Tracie, thank you both so much for your time. We appreciate the work you're doing, and good luck and continue the fight. So thank you both so much for taking the time.
Thank you for having us.
It's a pleasure. Thank you.
So on today's State of Play, Bruce, we're really going to get into some of the numbers and stats surrounding the mental health crisis impacting children. We know in the last few years, both the American Academy of Pediatrics and the U.S. Surgeon General's reports have really declared that there's a national emergency surrounding the state of child and adolescent mental health today.
And what we know is that, for example, Black youth suicide rates are rising faster than those of any other racial or ethnic group in America, and twice as many Black children as white children lost caregivers to COVID-19. So in addition to the crisis for all kids, there's a even more pronounced crisis among Black children.
Yes, and we also know that Black children are more likely to be physically restrained than white children, and also more likely to receive a diagnosis of a disruptive disorder, such as oppositional defiant disorder, than white children, who are more likely to be diagnosed with ADHD or ADD.
The other crisis that I think is somewhat neglected is that we had, over time, through Medicaid and CHIP, really cut the disparity in the uninsured rate between Black, white, and Hispanic kids pretty dramatically. And since the end of the COVID era, and now we're going through this Medicaid unwinding process where kids who were required to be left on Medicaid throughout the crisis so that people didn't lose coverage are now being disenrolled. And what we're now seeing is a growth in the disparity again between Black and white children in terms of coverage.
And we all know that coverage does directly impact disparities because a lot of families do not have and can afford, sending their child once a week to a therapist, paying $100 plus per session. That's not in the cards for most American families across the country.
Yeah, there's so many issues. There's definitely the coverage issues and the access issues, and it creates all kinds of different answers that we really need to address in public policy to really improve health services for children with respect to mental health.
So, Bruce, right now, is there any legislation that is moving that you see at the forefront as it relates to mental health? We've been hearing that this is a bipartisan issue and things that members of Congress from both sides of the aisle can get behind. But what is actually moving? What's the policy that's being developed?
There's a variety of initiatives that are going on in Capitol Hill right now, and it does address this problem of between coverage and access and workforce and service delivery, right? So one point is that Medicaid disenrollment, or what people are referring to as the unwinding process, which is that kids during COVID were required not to be disenrolled. And since that public health emergency has ended or was declared to be ended, states have gone through the process of disenrolling kids. And unfortunately, in states like Florida and Texas, hundreds of thousands of children have lost health insurance. And so that is creating a crisis in of itself. More than 4 million kids have lost health insurance. So that's one thing that Congress is looking at is ways to try to mitigate the growing uninsured crisis. And again, that is growing the disparity between white and Black kids. If you're concerned about race equity, and which we are, this is something we need to address. With respect to services and access, lots of examples there of things that Congress is thinking about. One is that school-based health services are really a place where kids are. We should be improving and making sure that every high school in this country, and junior high school, frankly, have access to school-based health services. And that is not available. In fact, as funding has been cut in a lot of states across the country, those are some of the first services that get cut. And as we were having this cultural backlash in some states, there's actually been this push to eliminate mental health services. Moms for Liberty, for example, recently came out and said they do not support mental health services to be in schools, when that is exactly what kids need. There's also a crisis with respect to where services are provided. And I think that we would all agree that community-based services are the most effective. Unfortunately, what we've seen is some really disturbing trends where kids have been institutionalized for mental health and behavioral health needs. Paris Hilton actually has really led in that initiative to try to get kids deinstitutionalized. And so that's another area where there's some legislative action and considerations. Then there's sort of the problems even when you have insurance, right? So managed care creates barriers and limits access to services for people. So for all of us who have health insurance, sometimes when you need care, managed care creates a prior authorization requirement before you can be referred. And that is often the case with mental health services. And so right now, the Senate Finance Committee is actually doing an investigation on prior authorization and how that is limiting access to care. And then another thing is Congress passed years ago mental health parity, which requires that services offered for physical health must also be provided in mental health. And that has not happened. So there needs to be some push to fix that. So lots of things are being considered and talked about, but really nothing has happened. Nothing has passed into law.
And it seems like we need to get moving on that. For the work that First Focus has done, nearly 20 years, mental health is a growing, budding portfolio for us. And it seems like on the front, as it relates to federal policy and advocacy, both at the federal level and at the state and local levels, there's a lot that needs to be done because we're not going to see this trend going away. All the different issues impacting kids today, from technology to social media to, this new uncharted wave of AI to, bullying to, you name it. There's a lot of things kids are facing now. Just the pressure of being a kid today just feels different than what it felt like 20, 30 years ago. And so it seems like, we need to get moving on some of these policies to make it easier for not only for kids, but for parents, right? Because oftentimes it's the parents that are navigating the insurance process and setting up these appointments and setting up the coordination. That let's not give them more work or more of a burden or more hurdles to jump over.
Yeah, kids definitely need access. As this podcast has shown, kids are in crisis. And instead, what we're doing is limiting access to services. And this is a problem that is leading to, all kinds of horrific outcomes, such as rising suicide rates. And so we need to do all we can to do better by our children.
Absolutely.
This is Speaking of Kids. Thanks for listening. I'm Bruce Leslie.
And I'm Messellech Looby. Special thanks to our guests, Taraji P. Henson and Tracie Jade.
Speaking of Kids is a podcast by First Focus on Children.
Elizabeth Wyndham is the supervising producer, and Julia Wyndham is the associate producer.
Layla Nimatala is the advocacy and mobilizing producer, and the senior producer is Jay Woodward.
Our theme music is Don't Look Twice by Sam Barsh.
For more information about this week's episode, go to firstfocus.org. You can find all of our links in our show notes.
If you have any thoughts, questions, or interest in becoming a First Focus on Children ambassador, email us at speakingofkids@firstfocus.org.
And please follow, rate, and review on Apple Podcasts, Spotify, or YouTube.
Speaking of Kids is produced by Windhaven Productions and Blue Jay Atlantic.